Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for uterine cancer. What is uterine cancer? Hope you have a basic idea of uterus. When abnormal cells grow in the uterus uncontrollably with destruction of normal cells and other grave signs and symptoms, it is called uterine cancer. Actually, all cancer means this uncontrollable increase in multiplication of cells without any intention, and that uncontrollable cell division goes on incessant, indefinitely. Now, what are the types of uterine cancer? There are two types of uterine cancer. One is endometrial cancer, 95%. It occurs in the endometrium, inner lining of the uterus, and commonest. Look here, this is the uterus. This is the void space, and these are inner lining. Inner lining is called endometrium. When cancer cell spreads on this inner lining, it is called endometrial cancer. And this is the body of the uterus, the body of the uterus, muscular body. Here occurs myometrial sarcoma. Sarcoma is another type of cancer. Uterine sarcoma, it occurs in the muscles of the uterus, myometrium, and rarest. This occur only 5% cases, this occur 95% cases. Sarcoma, that is in the myometrium, and in the endometrium, endometrial cancer. These two types of cancer are there in uterus. What are signs and symptoms of uterine cancer? Unusual vaginal bleeding, especially after menopause. Having usual menstrual period or changes in periods. Periodical bleeding continues without break. Watery discharge with unpleasant smell. Abdominal pains and discomfort, difficulties urination, changes in bowel habits. Please mind that these are not necessarily related to uterine cancer only. That is, all this or each one of these means uterine cancer is surely that is not so. There are other tests for confirmation. What are the premonitory symptoms of uterine cancer? This is very important. Premonitory symptoms, because from these you can catch the cancer early. These symptoms asterisk in this way, this is within brackets star, are the premonitory symptoms. That is unusual vaginal bleeding, especially after menopause. Heavier usual menstrual period, changes in period. This is for normal ladies. This is after menopause, ladies of menopause, after ladies, and watery discharge with unpleasant smell, all cases. So these three are the premonitory symptoms. What are the causes of uterine cancers? Following factors increase the risk of uterine cancer. Reaching climacteric period, age over 45. Never having issues. Endometrial hyperplasia, thickened wall lining. Having early menarche, first menstruation, is called menarche, 12 years. Before 12 years, it is before 12 years, then she is getting early menarche. Having diabetes or high blood pressure. Being overweight. Having genetic conditions like Lynn's syndrome, etc. Having family history of uterine or ovarian or bowel cancer. Having previous history of ovarian tumors, polycystic ovarian disease. Having hormonal replacement therapy or fertility treatment. Having exposure to radiation therapy in pelvis. Having few remedies related to cancer like tamoxifen, etc. That is from modern allopathic medicine related to cancer, and uterine cancer may come up. How to reduce the risk of uterine cancer? Having Pap test yearly. Actually, Pap test is for basically for the face of the uterus, that is cervix of the uterus. The cervical cancer. Cervical cancer is not truly uterine cancer, it is cervical cancer related to uterine. It is lower part of the lowest part of the uterus. Pap test is very nice to catch up this type of cancer, that is endometrial cancer, at the very early stage. Pap test. Controlling body weight, controlling blood sugar, keeping oneself physically active. This is very, very, very important, and is given triple star. Getting enough green veggies and fruits, avoiding red meats like hot dog, etc., canned, tinned, packet food, drinks, having oneself checked by gynecologists periodically, having avoid practicing things that lower the immune power like addictions, frequent night watching, being shy and too much introvert, inability to express your anger, sorrows, other emotion outwardly. Actually, this also indirectly helps in producing cancer within the system. That is, if you are too shy and too introvert and you cannot protest to you are being insulted unjustifiably, and you just get it in your mind and get your pang of in your heart, but you cannot express, this type of thing also may create cancer within. So you have to be against this thing, and that you have to learn how to protest calm and quietly. But you have to protest. When you protest, this internal the pang will come off, and that will not danger your internal organ. You have to express your anger, sorrows, and other emotions outwardly, but in a very convenient manner. You should not create any sin so that you are entangled in some difficult trouble and some police cases come up. That you should not do, but you must protest. You must raise your objection in a firm voice, and that will dilute your internal pressure. Getting sound sleep for 7 to 8 hours daily. It is another very good symptom, very important point. During this sleep, your immune system gets strengthened. So that sound sleep is also an important point. And unless your immune system is damaged, you cannot get cancer. Cancer cannot be, cannot get anybody whose immune system is okay. Cancer comes up there where the immune system is in the low ebb. Arsenicum for uterine cancer. That is, we are starting the remedies. Open cancer of uterus. Profuse acrid yellowish unpleasant discharge, burning sensation ovary in uterus region, stitching pain of ovary uterus radius towards thighs which feel numb and lame, worse from motion and bending, patient highly restless, anxious, thinks disease, that is his disease, is incurable, no need of taking remedy, they would die. This is their conception about their own disease. Bufo or Bufurana for uterine cancer. Menses too early, too copious. Cancer of mammary glands, tumor of polyps in uterus, metastasis change in cervix, burning in uterus and ovaries, cord-like swelling from groin to knee, milk leg or phlegmasia alba dolens. This is the phlegmasia alba dolens symptoms. Note the leg is somewhat blanched and whitish, some swollen. This is because of there is a clotting of vein, clotting of within the femoral vein. There is clot formation, so blood circulation is impeded, and this edema-like appearance appeared. This is called phlegmasia alba dolens or milk leg. This is the standard leg. This is affected leg. This occurs in uterine cancer also. Oramur netronatum for uterine cancer. Dr. Barnett said this remedy has more powerful effect on uterine tumors than any other remedy. Most adapted to person with syphilitic taint. That is the ladies with syphilitic background. When affected with uterine cancer, this medicine will come up for them. Cervix indurated palpitation of young girls, ulceration of neck of uterus, uterus so enlarged to occupy the whole of pelvis. Magnesium mure for uterine cancer, specially adapted to ladies with uterine troubles and liver ailments. Menses black, clotted, pain in back and thigh, leukorrhea with every stool and after exercise, abnormal bleeding from uterus during intermenstrual bleeding. Pure symptom of cancer in uterus. Alumen for uterine cancer. Fibroids and other malignant tumors of uterus in ladies with psychotic tint. Previously it was syphilitic, here it is psychosis. That is when the patient miasm is at the background psychosis, or that is thoracic no, the psychosis. Then for uterine cancer, this alumen will come up. And when there's what remains says, induration of the neck of uterus, chronic yellow vaginal discharge, aphthous patches in vagina. These are all symptoms of cancer in uterus. Ars art for uterine cancer. Uterine fibroid with patients of tuberculosis. Uterine fibroid with myocarditis and fatty degeneration of heart. Uterine cancer with lump in breast and dwindling of breast. This is ars iode actually a almost a very specific remedy for uterine cancer of particular ladies who are just affecting for TB or heart disease or breast cancer also simultaneously. Though simultaneous cancer is rare, but it may be often. Then ars iode will come up surely. Thlapsi bursa pastoris for uterine cancer. Uterine cancer in patients with high uric acid. That is cancer patient with high uric acid. Severe hemorrhage from uterus, leukorrhea before and after menses, chronic sufferers of menstrual problems, hardly recover from one period before another begins. That is, this lady has got a chronic history of suffering from menstrual period. Sickle core of uterine cancer, burning pain in uterus, brownish offensive leukorrhea, uterine malignancy with angina pectoris. Uterine malignancy means cancer actually, with angina pectoris. Uterine malignancy in thin, scrawny, old, cachectic ladies with intolerance of heat. Ravenous appetite with unquenchable thirst. This is a characteristic feature of sickle core.